Hi, my name is Haley and I'm going to be demonstrating the insertion and removal of a catheter on a female patient. So the first thing I'm going to do is I'm going to check my patient's chart and make sure that they have an order for the catheterization. Then I'm going to introduce myself to the patient, tell them what we're going to be doing today, the reasoning for why they need a catheter. I'm also going to ask my patient if they have any allergies, especially to iodine, because that's what we will be using during the procedure. I will then make sure I close the curtain and shut the door and provide my patient with privacy. I'll then raise the bed to a comfortable working position, and I'm going to expose my patient, just the area that we will be working with today. So after that, I'm going to perform some hygiene, and at this time I would put on regular gloves and I would clean the patient with soap and water. With the female patient, you would just make sure to use different parts of the washcloth and swipe down each side of the labia and down the center. So once my patient is all cleaned up, I am going to provide hand hygiene again, and I'm going to start opening my I'm going to remove my gloves, and I'm going to pick up the drape, and I'm going to lay that underneath my patient, and then I would take my second drape and I could extend my field if need be. And then we will not need the fenestrated drape for this procedure. Then next I am going to put on my sterile gloves. So I'm going to do this on the side of my patient's bed. My glove is ripped. At this time, I would get a new set of sterile gloves and put them on. I'm going to proceed with the procedure. Okay, I would this card. Okay. So next I am going to organize my kit. So at this time, I do have hydrogen peroxide. This is just for extra cleaning if we needed it. I'm going to put that aside. I'm going to take my iodine and I'm going to saturate my cotton balls. And then I'm also going to open my lubricating jelly and pour that into my field as well. I'm going to take the catheter bag out. Okay. And then at this time, I will open up the tip of the catheter and place that in the lubricating jelly. And then I'm also going to attach my syringe to the port. Next, I am going to disinfect my patient's perineal area. So I'm going to take the cotton ball and I'm going to do one swipe all the way down to the anus, from the meatus to the anus. And discard. And take a second one down the middle, from the meatus down to the anus. And then the last side. And I would discard that. So next, once the tip is all lubricated, I'm going to move this onto my drape here. And I'm going to ask my patient to bear down. I'm going to pull the labia apart and ask my patient to take deep breaths and then begin inserting the catheter. So I'm going to insert the catheter until I see a flash of urine. So on this patient, it's about there. I see the flash of urine. So now I'm going to hold the catheter in place and start inflating the balloon. Okay, I'll discard that. And then once the catheter is in place, I would tug, and I feel resistance because the balloon is inflated. And then I would take my catheter bag and hang it on the edge of the bed. Okay, if I did need a urine sample at this time, I would collect it straight out of the urine bag, and then I would clean up all my supplies and discard and remove my sterile gloves. I would also put my patient back into a comfortable position, cover them, lower the bed, put the side rail up. But I am going to demonstrate how to remove the catheter. So I would just explain to my patient again that what we will be doing, we'll be removing her catheter. I will then perform hand hygiene and put on regular gloves.
Because I would panic if that happened.
So the first thing I'm going to do is I'm going to grab an empty syringe and I'm going to connect it to the port. And gravity should start removing most of the fluid to deflate the balloon. With this one, it's doing it partially, so I am going to help it along the way. Okay. Once I get to the amount of fluid that was inside the balloon, okay, remove that. And then I am just going to tell my patient that I'm removing the catheter, and I would discard the catheter kit. I would cover my I would clean up my patient if there was any. I would just clean them up after the removal of the catheter, and then I would cover my patient back up and lower the bed, put them in a comfortable position. I would then remove my gloves and perform hand hygiene.